What is Lasix? Lasix is the brand name for furosemide. We refer to this prescription medication sometimes as a water pill because we use it as a diuretic to reduce extra fluid in your body. How does Lasix work? Lasix makes you urinate more by working on a specific place in your kidneys called the loop of Henle. That is why Lasix belongs to the family of loop diuretics. It works in the kidney to get rid of extra water and electrolytes like sodium and potassium. In this way, Lasix helps reduce your swelling and can also lower your blood pressure. What is Lasix used for? Lasix is used to reduce swelling. Swelling is also known as edema. Edema can be caused by a variety of other medical conditions such as heart failure, liver disease, or kidney disease. Lasix can also be used to treat high blood pressure. Dosing. I'm just looking at the tablets and the doses are 20 milligrams, 40 milligrams, and 80 milligrams. Doses are typically started around 20 milligrams and can be titrated gradually to manage edema symptoms. If it is used to treat blood pressure, your doctor will use higher doses starting at around 40 milligrams daily with the goal of dosing twice daily. And if you're interested in other blood pressure medications, click on this link above. 18 tips about Lasix for better symptom management. Number 1. With Lasix, it usually makes you urinate more within 1 hour of taking the medication. This effect lasts 6 to 8 hours, so do not take Lasix too late in the day or at nighttime, as you might be always ending up running to the bathroom. Number 2. Lasix can cause dizziness and sometimes a sudden drop in your blood pressure. Especially in the first couple of days when you start this drug, take your time when you're getting up, and especially if you're going up and down stairs. Number 3. Lasix can affect your electrolytes such as potassium or sodium. Your doctor will have to check your metabolic profile occasionally. Number 4. If you're on Lasix and your potassium is consistently low, your doctor might decide to place you on potassium supplements. Another alternative is to eat more potassium-rich food such as bananas, potatoes, or oranges. Number 5. Lasix can increase the chance of a sunburn as it is photosensitive. When exposed to the sun, make sure you're adequately protected by wearing protective clothing and, if need be, sunscreen. Number 6. If you do have a sulfur allergy, please tell your doctor, as your doctor may need to use another kind of diuretic instead of Lasix. Number 7. If you have diabetes, Lasix can increase your blood sugars. Make sure you're monitoring your blood sugars regularly. Number 8. This medication can exacerbate gout attacks. Lasix can increase your urination, which reduces the amount of fluid in your body. But the remaining fluid is more concentrated, which can increase the risk that you will develop the crystals that cause gout. If you're prone to them or at risk, have a discussion about this with your doctor. Number 9. If you have lupus, this drug can make your lupus active or get worse. Tell your doctor right away if you get any new or worse symptoms. Number 10. In older adults, the general rule is to start at a lower dose, usually around 20 milligrams in the morning, and the dose can be titrated to manage symptoms gradually. Number 11. Lasix can lead to acute renal failure, especially in older adults because of fluid loss. The fluid loss can be coupled with a loss of potassium, magnesium, and calcium. This may predispose you to cardiac arrhythmias. Your doctor will have to judiciously dose your medication by getting regular blood draws, as well as backing down on the dose to avoid renal failure. Number 12. Lasix can cause ear ringing and in some cases hearing loss. These are generally reversible. However, there have been some cases reported which are irreversible. Number 13. There have been cases reported of severe allergic reactions such as Stevens-Johnson syndrome and toxic epidermal necrolysis. In such cases, immediately go and rush to the hospital for emergency care. Number 14. GI symptoms can occur such as abdominal pain, nausea, constipation, and diarrhea. Here your doctor can adjust the dosing or the timing of the medication to minimize these side effects. For example, if you have diarrhea, your doctor in discussion with you might want to reduce the dose of Lasix. Number 15, make sure that you do drink water, especially in the heat of summer or if you're exercising and sweating a lot. You may be feeling nauseous or unwell because of the combined effect of Lasix and dehydration. Number 16, if you have a feeling your Lasix is not working, make sure that the other instructions which you should be following are being adhered to, such as reducing your salt intake. Reducing the amount of sodium you're taking can increase the effectivity on the loops where Lasix is working, and then Lasix can be more effective. Number 17, Lasix can rarely affect your blood count. Your doctor should follow up with a complete blood count at least yearly. Number 18, sometimes this medication can cause an abnormality when checking your thyroid levels. If that is the case, your doctor might want to repeat your thyroid panel to verify the results. And a bonus tip, do not use Lasix to treat the edema from a venous insufficiency. Here I would recommend to avoid sitting or standing too long or going for walks to activate your calf muscle pump. And you can use compression stockings. Compression stockings help with blood flow or compressing the blood flow towards your heart. And if you're interested in other videos, click right here, or click right here, or here, or here. Have a good day and think your health. I think that went well. Oh, battery's running low. Battery's running low. Done. Good. Oh my God, a tickle. That's a wrap.